LeBron James suffered a right foot injury in the game against the Mavericks on February 26th. While it's not exactly clear what the injury is, reports say that he should be out for about 3 weeks and that they'll reevaluate then. In this video, I'm going to explain a breakdown of some possible explanations for the injury, how devastating it may be to LeBron's career, and if 3 weeks is an accurate prediction. If you are new here, my name is Dr. Nessim. I'm a resident physician with an interest in sports medicine. So there are a number of different sports injuries that you can have in the foot. You can have ligament injuries, such as a high ankle sprain, tendon injuries, such as an Achilles tendon tear or rupture, injuries to the midfoot, such as Liz Frank ligament sprains, bone fractures, or you could have injuries to the plantar fascia such as plantar fasciitis or full plantar fascia rupture. On an episode of Brian Windhorst and the Hoop Collective podcast, Windhorst stated that I've heard what the injury is, but it's not confirmed, so I don't want to say for sure, and then it be attributed to me and not be 100% right, but I've heard basically it's not a sprained ankle, it's a tissue injury, and there's nothing you can do. You can't play on it, you just have to let it heal. So this leads me to believe that it's not as serious of an injury if it won't require surgery, and may most likely be plantar fasciitis or a plantar fascial rupture, given that when the injury occurred, LeBron actually said that he heard a pop. So what exactly is plantar fasciitis? Well, in simple terms, this is inflammation of the plantar fascia, which is a thick band of tissue that connects the heel bone to the toes. It's a common injury among runners and other athletes who put a lot of pressure on their feet. The plantar fascia can become inflamed or irritated, causing pain and discomfort to the heel and the arch of the foot. Now, some potential causes of plantar fasciitis include overuse, such as repeatedly putting pressure on the plantar fascia, or if you have specific foot mechanics such as flat feet, high arches, which can put more stress on the plantar fascia, eventually leading to injury. The recovery time for plantar fasciitis can vary depending on the severity of the injury and the individual's response to treatment. Mild cases can often be treated with rest, ice, stretching, physical therapy, and athletes can generally return to their sport within a few weeks, slowly progressing to play. A plantar rupture is less common and can be a more serious injury, although the plantar fascia is not as integral to the structural integrity of the foot as, for example, the Liz Frank joint. Treatment will usually include immobilization in a walking boot, physical therapy, and in some rare cases, surgery, although reports said that LeBron will not need surgery and that he will be reevaluated again in 3 weeks. My best guess is he will be in the boot for about 2 weeks, maybe a little longer, then slowly start to increase his activity. He will likely be on a minutes restriction when he first comes back, and how much he can play will also be determined by his pain tolerance if the plantar fascia is acting up. That, of course, is if this is actually the injury he has. Based on all this, he will probably be back in 4 to 6 weeks, just in time for the NBA playoffs, so good luck to LeBron, and for the Lakers fans, I hope he comes back soon.